Good afternoon, everyone, and welcome to the Animal Medical Center's 2021 Living Legend celebration. While it's unfortunate that we are still not able to celebrate our honorees in person, I am grateful that we have this opportunity to gather virtually to hear the stories of some remarkable pets who have thrived thanks to the knowledge and skills of the Animal Medical Center's clinicians and the love and commitment of their families. I am truly grateful to these families for allowing us to share their pet stories and for their participation in this virtual event. I also want to thank all of you for taking the time to join us today and for your generous contributions that ensure we can continue to fulfill our multifaceted nonprofit mission of compassionate care, education, and research, all of which make these stories possible. This is particularly true for one of the honorees that you will hear about today, who is a beneficiary of our Frank V. D. Lloyd Fund for Guide Dogs. This fund provides free veterinary care for guide dogs working with visually impaired individuals. The fund, like each of our 12 charitable community funds, is entirely dependent on contributions from our donors and would not be available without your support. For over 110 years, the Animal Medical Center has played a vital role in veterinary medicine, and we intend to expand upon that legacy in the years ahead through our Gift of Love capital campaign. This transformational 3-year renovation and expansion will add more than 11,000 square feet of new space, and we will be renovating more than 26,000 square feet of existing clinical and client space. Despite the ongoing pandemic, we remain committed to these plans, and we are excited to be breaking ground in June. This project is essential to ensuring our future as a leader in veterinary healthcare, and most importantly, in our ability to meet the needs of the pets and clients we serve. And now it's time to meet this year's Living Legends. One of the unique aspects of AMC is the sheer volume of cases that come through our doors, nearly 54,000 in 2020. With this number of cases, it is not surprising that we often see things that have never been seen before, and then have an opportunity to conduct procedures that also have never been done before. Mina is one such case. An Animal Medical Center surgeon, Dr. Daniel Spector, will tell you Mina's story.
Thanks very much, Kate. She's a 5-year-old cat who came into the AMC over the summer after suddenly having very difficult time breathing at home. She spent a few days at an emergency hospital trying to determine why she was having a hard time breathing. A battery of tests were run, and they found fluid around her lungs, but they didn't know exactly why the fluid was accumulating, nor did they have the capacity to treat her fluid. And so they sent Mina over to the AMC for further diagnostics and ultimate treatment. When she got to AMC, she was having difficulty breathing, her gums were blue, and she was in distress, and the emergency and critical care team were able to stabilize her and move her to the internal medicine team, who continued the testing, ruling out heart disease and other potential causes of the fluid. What they ultimately did was a CAT scan, and what they found was there was not only fluid around Mina's lungs, but there was a thick rim of scar tissue around all of her lung lobes that were preventing them from expanding. So it was really making it impossible for her to breathe. It was a condition called chylothorax, and that's a condition where we can see lymph fluid leak out and into the chest. And in cats, it's very, very irritating, and it causes this scar tissue to form around the lungs. At that point, the fluid wasn't causing the problem with Mina's breathing. It was the scar tissue encasing her lungs. That was the problem. And so the internal medicine team asked me to reach out and talk to the owners, because there's nothing medically that's possible at that point. And frankly, I had to have a very difficult conversation with her owners and her family that there's really no good surgical options. After extensive discussion of what was going on and what even the potential surgeries could look like, I actually had to give them the grim news that I gave them a less than 5% chance that Mina would even survive the surgery, and I thought that was an optimistic estimation. But after a lot of conversation with her incredible family, they elected to move forward with this operation, which is an open chest surgery where we went in and we removed all of the scar tissue that was encasing her heart, preventing it from beating appropriately and normally, and freeing up her lungs and removing it from around her lungs. And even in surgery, remarkably, as you cut away that scar tissue, you could see her lungs start to slowly expand and look more normal. She made it through surgery very, very well, and she moved into the ICU where she recovered. She was in the hospital for almost a week with chest tubes in place, supplemental oxygen, pain management, and a little bit every day. Her lungs sounded better, she felt better, she was able to breathe better. Mina has beaten the odds in an incredible way, to the point where we have submitted for publication Mina's case, because Mina is the first cat that has ever survived this surgery for this disease. And not only has Mina been a miracle to her family and to all of us, but Mina will hopefully continue to offer hope to other cats and other families out there when faced with this disease. It's my honor to give the Living Legends Award to Mina, because I can't imagine anyone who deserves it more.
Thank you, Dr. Spector. I think you will all agree that Mina's story exemplifies not only the groundbreaking work that occurs at our hospital, but the incredible dedication of her owners, who wanted to pursue every possible option to help their beloved cat, and were fortunate to have had that opportunity at the Animal Medical Center. Our second living legend, Newton, will be introduced to you by Dr. Madison McKay, who is a second-year resident in AMC's internal medicine service. Dr. McKay has played a lead role in Newton's care, but this case will also demonstrate the team approach to veterinary care at the Animal Medical Center, which allows many specialists to work together toward the health and well-being of our patients.
Thanks, Kate. I'm so happy to be here. I met Newton's outer about a year ago when she came in through the emergency department for trouble walking. For the days before that, she was slowing down, having some trouble moving her back legs, and then in an emergency, she wasn't able to walk. Our great team here at the emergency department was able to triage her. She had some diagnostics with multiple departments, the emergency department, radiology, neurology, and the orthopedic surgery department, and we realized that there was a big clot in Newton's aorta blocking off her blood flow. And then we realized that we had to intervene very quickly. We spoke to the interventional radiology department, and here at the Animal Medical Center, we were able to do a procedure that people don't really do anywhere else. We were able to place a stent in her aorta to resupply blood flow. Now that may seem like an easy thing, but that's a difficult thing to overcome. Over time, you need rehab to redistribute the blood flow, make sure she's feeling well, and get her back to her normal self. She did great. She spent some time here in the hospital. She got on some medications. They came up with a whole exercise regimen for her, and she went home. She did awesome. Weekly visits coming in, tweaking her medications, making sure the clot didn't reform. She was feeling well, no pain, and Newton was really doing great. Against all odds, she went through this stent. Unfortunately, yet again, Newton had a problem. In the summer of 2020, she was having some problems with her heart and trouble breathing. She came in again through our emergency department, and she was found to be in heart failure. Her heart wasn't functioning. She had a terrible arrhythmia. Quickly, our cardiology department and our surgery department with Dr. Spector was able to place a pacemaker in her. We got her out of heart failure. That recovery was even harder. She was here, she's had some renal injury. She spent many weeks in the hospital. She had time in the ICU with our critical care staff, and we were able to get her out yet again. She beat all odds. She went home. She had a great quality of life. Unfortunately, she was here for a rehab appointment a couple months ago, and we found a little lump on her. Quickly, the oncology department realized she had lymphoma. She's done great. Weekly treatments of chemotherapy, weekly visits all through the hospital with everyone that she loves. The best thing about Newton is every time she comes here, she's happily greeting all of the front desk staff, comes up to see all the doctors, and she's as excited to see us as we are to see her. Since then, she's been doing well. There's nothing more amazing as a doctor to see a dog go through all of those feats and come out with flying colors. And that's why it's my honor as Newton's doctor to present her with this year's 2021 Animal Medical Center Living Legends Award.
Newton is fortunate to have a loving owner who has been deeply committed to providing the best possible care available from numerous specialties at AMC. And residents like Dr. McKay, who trained at AMC, also have an opportunity to participate in complex cases that prepare them for the next steps in their careers. The Jackie Santee Flaherty Award for Courage, created 4 years ago by our longtime trustee, Tina Santee Flaherty, in honor of her beloved dog, Jackie. The award is given annually to a dog who, like Jackie, has demonstrated bravery throughout illness and treatment. All of us at AMC are so grateful to Tina for this meaningful tribute to Jackie and for her ongoing support of the Tina Santee Flaherty Rehabilitation and Fitness Service.
Thank you, Kate, for that wonderful introduction. I thought it might be helpful if I gave you a little bit of background information about the Jackie Santee Flaherty Award for Courage. Jackie was my white lab. She was named after my neighbor, Jacqueline Kennedy Onassis. Like Jacqueline Kennedy Onassis, Jackie was beautiful, she was loving, and most of all, she was very, very brave. Jackie was very special to me, as you can imagine. For many years, my dog Jackie courageously battled cancer. Thanks to her strength, as well as the support of her team at the Animal Medical Center, particularly Dr. Ann Hohenhaus and Dr. Lelani Alvarez, she lived many years beyond what her initial diagnosis might have indicated. To recognize Jackie's tremendous courage and to thank the Animal Medical Center for its excellent care, I decided to create an award in Jackie's honor. It will be given every year to another dog who has demonstrated similar bravery throughout an illness. The award comes with a gift that will be designated to the Tina Santee Flaherty Rehabilitation and Fitness Service. It will ensure that other pet patients can benefit from healing treatments as much as Jackie did. But the Jackie Santee Flaherty Award for Courage will enable Jackie to live on in our hearts. This year, the recipient of the Jackie Santee Flaherty Award for Courage is Rosa, a 10-year-old yellow lab guide dog. She has lymphoma and has been receiving chemotherapy treatments at the AMC for over a year. Congratulations, Rosa. You truly deserve this award.
Thank you very much, Tina. We all love Jackie. She was truly an amazing dog. Next, I'd like to introduce Dr. Nicole Liebman. She is the director of the Animal Medical Center's Cancer Institute, and she will share Rosa's story with us today.
Thanks, Kate. I'm so happy to be here to present this very special award to my patient, Rosa Robertson. Rosa is a 10-year-old female spayed Labrador that spent the first 2 years of her life training to be a certified guide dog. At age 2, she went to live with her forever mom, Jasmine. That was right about the time that she also started her lifelong care at the Animal Medical Center. For the first 6 years of her life, Rosa guided tirelessly and happily Jasmine every day of her life. They lived together, they ate together, they played together, and they were really very, very happy together. At age 8, in October of 2018, Rosa was here seeing our primary care service at the Animal Medical Center, and they recognized some enlarged lymph nodes. They also noted some abnormalities in her lymphocytes on her routine blood work. Rosa underwent a battery of tests to include chest radiographs, abdominal ultrasound, and some molecular testing. She was ultimately diagnosed with large B-cell lymphoma. Lymphoma accounts for about 8 to 24% of all canine cancers that we see here on the oncology service. Rosa's mom, Jasmine, immediately agreed to intensive chemotherapy, for which Rosa handled incredibly well. She immediately went into remission and had almost no side effects at all. She continued to go outside every day and work with Jasmine and live an incredibly normal life. She continued her chemotherapy for 6 months, and 6 months after that, she again came out of remission. Rosa's mom, Jasmine, immediately agreed again to another course of chemotherapy, for which Rosa did incredibly well. She attained a second remission. She stopped her chemo in January of 2021. Rosa's initial prognosis was about a year. We are now 2.5 years out, and Rosa is doing incredibly well. She goes to Starbucks every day for a puppuccino. She plays, she entertains, and she makes all of us at the Animal Medical Center very, very happy. She spent the first 6 years of her life taking care of her mom, Jasmine. Now, Jasmine takes care of Rosa through her diagnosis and all of her treatment. It's an incredibly touching love story that I am so humbled and privileged to be a part of. I'm very honored to be here today to present the Jackie Santi Flaherty Award for Courage to my patient, Rosa Robertson.
Thank you, Dr. Liebman. You know, Rosa is an inspiration and a reminder of the importance of the human-animal bond, especially between guide dogs and the people who depend upon them. We are so grateful to all the supporters of our Guide Dog Fund, whose contribution ensures that these dogs get the care that they need to sustain this essential relationship for as long as possible. I am so proud and honored to be part of the work we do at the Animal Medical Center and the team of clinicians who make these miracles happen each and every day. I thank all of you for joining us today and for your ongoing support. If you haven't had a chance to donate yet, but would like to, please visit the donate page on our website at amcny.org. Before concluding, I want to thank our honorees and their owners, and of course all of you for your participation and interest in our work. I hope next year that we will be able to celebrate in person. Thank you all.